Você é narrador, palestrante, forte e autoritária. O tom deve ser firme e inabalável. Este é o início da mensagem. Comece com energia total e um tom de comando, capturando a atenção imediatamente. You wake in the small hours with your heart jangling as if it forgot its rhythm. The thought comes unbidden. What if this is not only chemistry and habit, but a spiritual alarm, a soul nudged, a field of unresolved things tugging at the edges of sleep? According to the archived trance readings of Edgar Cayce, recorded over decades and kept in careful transcripts, many people's nightly disturbances were not mere pathology, but signals from three distinct nocturnal realms: the borderland of reunion and closure, the Akashic vault of records and guidance, and the pure spirit sphere of revelation and mission. Tonight, you will learn how those reports parsed anxiety as a spiritual symptom, what the readings reported back about healing, and practical, cautious steps you can take to prepare your nights for clearer, safer inner travel. If you find this worthwhile, stay with me through the whole exploration. Subscribe to the channel for more case stories and practical guidance rooted in historical trance testimony, and leave a comment if a passage echoes in you. That helps this kind of work find people who need it most. Listen closely now. The seer at the center of those archives described the first realm as the borderland, a threshold where the living meet the recently departed, where unfinished conversations and tender hurts are handed across like wrapped parcels. In one recorded account, a woman who had been waking with a tightness in her chest reported meeting her brother there. She described a narrow shore of mist where voices carried like shells to the ear. He was sitting on a stone, she later told Cayce through the trance, and he smiled like he always did when he forgave me. He took my hand and handed me back the thing I had buried. The reading recorded her physical symptoms easing within days, and the archivists noted, clients later reported a psychological smoothing after such reunions. Note the caveat that follows. These accounts are reports from trance sessions, not clinical trials. If you suffer persistent panic or bodily symptoms, seek medical or mental health support even as you explore spiritual practice. The second dimension the records name is the Akashic sphere, a vast library where one may, allegedly, request and receive impressions of a soul's pattern and lessons. A middle-aged engineer in one reading claimed to stand among shelves taller than any cathedral and to pull down a slim volume that contained, in a series of images, the choices that led to a chronic tension he had carried for 20 years. I saw myself refusing to speak once, again and again, he said in the trance narrative, and the weight of those silences had fixed in my throat. The guide in that scene did not promise an instant cure. Rather, the archive's transcript shows the engineer with an instruction: name the first small truth you will tell tomorrow. Within weeks, he described fewer sleepless, knotting moments. Again, these are testimonies recorded and interpreted by a medium, and while they attest to perceived transformation, they are not prescriptions that replace care from qualified professionals. The third and loftiest realm is described in the files as pure spirit or God consciousness, a luminous plane where identity loosens into purpose and a person's small anxieties are seen within a wider work. One reading recounts a nurse who, tormented by recurring panic on the night shift, drifted into a field of bright, humming presence. In that place, a voice, not commanding but coaxing, said, This intensity of feeling is a signal, not your enemy. Let it be the bell that sets you on a path. The narrative that follows is not mystical triumphalism. It describes the nurse's slow reorientation. She took smaller night shifts, learned breath practice, began caring for patients with a new steadiness derived not from erasing anxiety, but from holding it as information. The readings frame anxiety sometimes as a messenger of misalignment rather than purely as malfunction. To speak plainly about anxiety as spiritual is to risk two errors: romanticizing suffering and ignoring biology. The archived testimony swings between those poles. It suggests that some nocturnal distress layers over unresolved relational griefs, karmic patterns, or unintegrated mission impulses. At the same time, the transcripts consistently advise prudence, rest, professional consultation, and the use of grounding practices. They never, in their recorded voice, urge reckless abandonment of medication or therapy. Treat those readings as an invitation to add spiritual preparation to your existing care, not as a replacement. Now, let me walk you through a short map, and then we'll move deeper into each landscape with concise case stories and clear practices you can try tonight. We will move through Borderland encounters and their closure practices, into Akashic retrievals and simple dream incubation techniques to ask for guidance, into the pure spirit experiences and how to receive mission-level clarity without becoming unmoored. And we will close with protective measures: the silver cord visualization, the white light shield, and practical bedside rituals, all framed with safety notes. I will draw often on the phrasing used in the Cayce files: reported, according to the reading, the subject stated, because the distinction between what was claimed and what is verifiable matters here. Borderland is where grief often finishes its sentence. In a concise case, the files record a widower who began waking each night at 3 a.m., sweating with a childlike fear. In the trance, he described a garden beyond a low fence where a small woman in a gray shawl sat on a bench. She was quiet but glad, the transcript says. The medium reported the widower wept and then laughed, bursting into laughter in the reading. The meeting cleared some of his stubborn denial. In one account, a man who had been experimenting with fast, solitary projection reported feeling drained and anxious afterwards. A guide in the trance advised him to cease solitary techniques until he had built steadier grounding. The practical takeaway is to avoid reckless solo intensity. If you feel persistently worse after a visionary practice, stop and seek a qualified guide. Here are protective measures that recur in the files and that you can adopt simply and safely tonight. Begin with physical safety. Sleep in a familiar, tidy space. Avoid intoxication or heavy dissociatives before attempting any intentional dream work. Then use internal protections. Breathe slowly until your heartbeat steadies. Visualize the silver cord, a gentle, luminous thread connecting your heart to your body, tightening like a tether. Enlarge that tether by imagining it rimmed in white light, and then mentally surround yourself with a sphere of soft white light, like a warm lamp of presence that emits nothing harsh. Say aloud, if it helps, a simple boundary: only that which is loving and true may enter my night. Keep the words plain and firm. These measures are not mystical guarantees, but practical anchors that calm nervous systems and set intention. To practice dream incubation in 3 simple steps, adapted from the sorts of instructions the reading suggested: first, clear a single question and make it specific.
Second, set a small physical anchor, a note card or a small cloth under the pillow, spoken over with one line of intention. Third, upon waking, resist the urge to check your phone or immerse quickly in waking life. Stay still for a minute and let the images surface. Then write. Repeat nightly for a week and note patterns rather than expecting overnight revelations. If images are disturbing or you feel destabilized, halt and consult a trained therapist or an experienced dream worker. The records also connect nightly processes to health and karmic adjustment. A case in the files tells of an elderly man who, after a series of readings, claimed to have released a long-held self-blame that had manifested as chronic neck pain. He reported that a dream-guided conversation taught him to forgive himself for a quiet shame. The physical pain eased over months. The archivists carefully recorded the patient's ongoing medical care alongside the trance claims, and the reading transcripts often include the seer's repeated instruction that spiritual work complements but does not replace medical and psychological care. This dual-path approach is crucial. Use spiritual practice as an adjunct to licensed treatment. Now, a short, delicate moment from the archives that speaks to the climax of such journeys. In a particularly lyrical reading, a woman described standing beneath a dome of soundless, honeyed light. Within it, she felt her anxiety not vanish, but rearrange. It became an arrow pointing towards a narrower, more courageous life.
She was given no grand prophecy, only a single image, a small, unlocked chest with a blue ribbon, and an impetus to take one specific risk in her waking life. She said she woke with a calm that was unfamiliar. The readings note that her nightly tremors decreased in frequency and intensity. The point here is not to promise that every anxious person will receive a symbolic chest. Rather, the archive's pattern repeats. When a person approaches sleep with intention, protection, and readiness to act on small instructions, the practices sometimes catalyze measurable shifts. After such high accounts, the practicalities must reassert themselves. A simple pre-sleep routine to try this week. Dim lights 40 minutes before bed. Avoid screens. Take 5 minutes to sit with a steady breath. Set your one-line intention aloud. Place your note card under the pillow. Visualize the silver cord and the white light sphere, and keep a journal beside you. If you are on medication or in therapy, tell those providers about your experiments. Keep them informed. If you have a history of psychosis, severe bipolar disorder, or are in a state of acute crisis, do not practice trance techniques alone. Speak first with a clinician who understands spiritual experience. There will be nights when your attempt yields nothing but quiet sleep, and that is normal. There will be nights when images come and feel thin, like scraps of cloth. There will be nights of transformative clarity. The readings teach patience more than expectation. When insights arrive, test them with ordinary prudence. Does the guidance increase compassion? Does it ask you toward responsible acts? The archive's favored instruction is always incremental. A small apology, a daily habit kept, one charitable act. Those are practical translations of grand visions. Before I close, a brief caution the files repeatedly assert. Watch for the temptation to spiritualize avoidance. Sometimes anxiety is a signal to change medication, to seek therapy for trauma, to set boundaries in relationships. Using dream work to sidestep necessary medical or social actions is to misuse the practice. The archival readings often paired visionary counsel with mundane assignments. Pay a bill, call your sister, get a checkup, and that grounding is part of their ethic. If you feel called to experiment, begin gently tonight.
Try the 3-step incubation, combine it with the silver cord visualization, record whatever surfaces, and refrain from dramatic solo projection. If anything feels destabilizing, stop and seek professional or experienced guidance. The archived readings of the seer present anxiety sometimes as a spiritual signal, a border call, a record to be read, or a doorway into mission. They do not reduce complex human suffering to myth. They position spiritual practice as one tool among many for tending the nervous soul. The archive frames karmic adjustments as patterns extended over months, years, sometimes generations. Repair is incremental, a series of small reckonings, each one visible, each one practical. Expect modest returns, less anxiety at a certain trigger, a calmer conversation, a bill paid that had been avoided. Measure progress by regularity of small acts rather than by extraordinary happenings. If a visionary event urges a life overhaul, ask, what is the first responsible, measurable step I can take within a week? The archive prizes that translation. When a session feels destabilizing, rapid cycling mood, intrusive images that do not settle, loss of sleep beyond 2 nights, stop and connect with a clinician. Do not treat the guide as a substitute for medical care. A responsible guide will honor that threshold and will not insist that every distress is spiritual. The seer's notes are frank. Some material is trauma memory or needs pharmacological attention. Envisioning cannot and should not replace clinical intervention. Confidentiality and record-keeping are practical matters the archive returns to as well. Keep brief, factual notes, date, intention, main images, one practical assignment. Avoid salvos of interpretive judgment in the file. Description first, explanation later. If a guide is working with multiple people in a community, make explicit agreements about anonymity and shared discussion. The archives contain painful examples of careless talk that led to shame or family ruptures. Prudence here is ethical care. For those who feel called to teach or to host group dream work, the seers advise a strict code. Obtain informed consent. Outline the limits of what will be discussed. Encourage individual follow-up with clinicians, and never pressure disclosures. Group contexts can be powerful, but also risky. They amplify suggestion and can confuse private material with collective meaning. A single guiding principle in the files: respect the autonomy of personal interior life. There are practical adjuncts that help stabilize overnight experiences. The archive recommends light hygiene measures. Avoid stimulants late in the day. Keep a regular sleep-wake schedule. Dim blue light in the hour before bed. And maintain a short ritual of intention rather than performing long liturgies that activate rumination. For some, a 30-second closing phrase, I close the night, I open the day, said while brushing teeth, becomes a predictable cue the mind learns to trust. If you choose to keep records and to bring them to a guide, make them comprehensible. Date each entry. 1 paragraph for images, 1 paragraph for feelings, 1 line for the practical step you actually did. In time, a pattern will appear. Repeated symbols, recurring people, habitual resistances. Those patterns are the archive's real treasure. They transform diffuse distress into a traceable loop you can attend to.